following your PhD, you probably had a choice of faculty or possibly coming to DC. What was the set of decisions you made there, Mark?
The program that I went to was focused a lot on methods and then sort of agnostic on the type of policy. And I went off to Albany and wrote my dissertation in Albany on healthcare. And so that was kind of my path. And then in graduate school, a lot of the people I went to school with, I would say even the majority, were headed off to teach. And there were parts of teaching I liked. I liked the actual classroom experience, but I still felt very strongly about going and doing, applied research and policy. That was something that I really wanted to do. And a, kind of ideal for me would be to go to the Urban Institute, which I ultimately ended up doing. But I do want to say this one thing now that you asked this, because something was said one night when we were all talking about our plans. And I was saying, I wanted to go to Washington and work on policy and have an impact, or whatever you say when you're a graduate student. And one of the other students said, well, I think, teaching students, generations of students over time is also a really effective way to have an impact. And I always thought that was a really important point. And one thing that I've tried to do when I, did get here, and particularly when I started managing people, was to always try and bring people along who work for me, like very much them, and, kind of bring them into their own careers.